Dave Popkin, Seton Hall Athletics, being joined by Ariel Scarpelli. She is the Program Director for Mobile Crisis Outreach Response Teams. That's MCORT, Essex and Hudson Co-Response Programs. How you doing?
Good, how are you?
Good. It's good to be here at MHA today. May is Mental Health Awareness Month. Why is that important?
So I just want to talk about what mental health awareness is. So mental health awareness is exactly that, bringing awareness and education to the general public about mental health conditions and why mental health well-being is important and how it plays into all the factors of our life. And mental health awareness is important because the more we bring education and information to the general public, the more likely we are to reduce stigma around receiving help for treatment, and the more likely people are to reach out for help. There is a lot of fear of judgment and discrimination that people often have associated when they're reaching out for help. So the more we normalize these conversations, the more that people will get the services that they need.
Let's talk a little bit about your program. What is 988 MCORT? How does that manifest?
So Mobile Crisis Outreach Response Teams, or MCORT, is part of the continuum of care that works with the 988 Suicide and Crisis Lifeline. I want to talk a little bit about 988 because while MHA does not operate the call center, it is directly connected to our MCORT program. So 988 is a suicide crisis lifeline that you can call, chat, text 24/7 and reach a trained crisis counselor. And that trained crisis counselor will do an assessment. And they might determine that the person would benefit from in-person support. And if they benefit from that in-person support, then our teams would be dispatched to Essex and Hudson homes within 1 hour of that call. MCORT will be available 24/7, 365 days a year, just like the Lifeline centers. And we have teams that are comprised of a couple different levels of staffing. So we have individuals that have lived experience. So that means they're in recovery from their own mental health or substance use. We also have individuals that have their bachelor's, and they are supported by a licensed clinician supervisor. The main goal of MCORT is to de-escalate crises, to go out there and help the person with whatever they're managing, to avoid unnecessary hospitalization, so keeping them in their homes whenever possible, to avoid law enforcement or incarceration, but most importantly, to link people to services as fast as possible. And we do that by making connections with community providers so we can get same day or next day access to services. And we follow up with people too. So we go out the first day, we do as much as we can, and then we will follow up to see if all those linkages worked out. And if they didn't, then we will, make sure that we provide additional linkages and resources.
When you initially go out, what does a typical dispatch look like?
MCORT, obviously, every crisis is different, every individual is different, so nothing's going to always look the same, but we are seeing some trends already. We're seeing a lot of people that are feeling lonely, generally feeling overwhelmed, anxious, depressed, have some financial issues, job loss, domestic violence, things like that. So what that would typically look like if we go out to, say, someone who has suicidal thoughts. Maybe they don't have any intent or plan, but they have these really intense thoughts that are kind of building. The first thing we want to do is go out and just get to know them, understand their story, what brought them today to call 988 and reach out for services. And we'll prioritize with them. What is the one thing they think that would help them with that crisis today? And if they're open to treatment for mental health or substance use services, we'll educate them on the different options there are. And if they're willing to go to treatment today, we'll even bring them. We'll go straight to the service with them. We'll sit there with the intake and make sure that they feel supported through that process, because that alone can bring up some feelings of anxiousness or nervousness. So we'll just support them through the entire process and continue to prioritize the other factors, because no one thing usually causes the crisis. There's usually multiple things. So if financial stressors or legal issues are also involved, we'll make those linkages and resources as well, and just make sure that the person feels supported. And at the end of the day, we just want them to feel more hopeful when we leave them from when we got there at the beginning.
What progress have you seen with the program since it launched statewide?
So the program went soft start very recently, March 3rd. And at that time, we just started Monday through Friday, 7 to 3. And then we have quickly expanded to being Monday through Friday, 24 hours a day. And we hope to go live on weekends soon. That will make our program 24/7, 365 days a year, just like the Lifeline centers. But since our start on March 3rd, we've been to over 70 dispatches across the state of New Jersey. And that's 70 opportunities and chances that we've had to help people de-escalate their crisis, stay in their home, and get the resources and linkages that they need.
How can this be a resource to our community, Seton Hall students, alums, etc.?
Yeah, so 988 is available to everyone nationwide. And MCORT is available across the entire state of New Jersey in every single county. MHA does operate the Essex and Hudson one, but it is available across the entire state. You can get in contact with 988 by simply dialing the numbers 988 or texting 988, and it's a really quick resource to get in touch with someone as soon as possible. But if you are someone who is concerned about somebody else, a loved one, a friend, a family member, and you don't know how to support them, you can also call 988 and get in touch with them and get resources and information to help the person that you're concerned about. But I think this is such a great resource for students. Sometimes with that fear or that discrimination that they feel like they might get, in order to just have it at your fingertips that you can call or chat or text someone right then and there, that makes it a little bit more approachable to get the resource that they need. And if they do want MCORT, so if they do want the in-person support, we can come and meet them wherever they want us to meet them. And I just want to note that we are not going to go out to people that don't want us there. It is a voluntary service. We're showing up as just our team, no police involvement, and only if you want us there so we can help support you through the crisis.
Is there anything that I've missed, something that folks should know about 988 MCORT that we haven't talked about?
So I think the most important thing with 988 is that this is an available resource that can help people. And bringing it back to mental health awareness, just the more we get the information out there, the more the education is out there to the public, the more people receive the services that they need and reduce suicide rates. There is help and hope out there, and this service really can save a life. So I think it's a great resource for everyone to know about.
Absolutely. Thanks for all your great work with this and for your partnership with Seton Hall over the years. We appreciate it.
Absolutely. Thank you for being here with us.
Okay. It's Ariel Scarpelli joining us here from the Mental Health Association.